Hello, this is Chaplain Chuck and welcome to the recoverychannel.tv. I'm new to the channel and I kind of want to introduce myself. What do I do? Like, what's my day job besides being a contributor to recoverychannel.tv? And I do work as a healthcare chaplain in a clinical setting at a medical hospital and a behavioral health facility, behavioral health hospital as well. So, I think I bring a lot of skills and a lot of experience helping people to improve their lives, but also in crisis. So what do I provide? Okay, I provide spiritual and emotional support for sure. My focus, whether or not I'm able to do that, at least when I leave the setting, hopefully I brought some comfort and some hope. Those are the two emotions we're kind of going for, comfort and hope. All right. So, areas of care that I'm involved in, mental health challenges. I offer one-on-one and group support to patients struggling with anxiety, depression, addiction, and suicide ideation. Any given week I would have patients from all of these areas. And it's a growing area. More on that later, but you can really see there is a mental health crisis in this country, particularly since COVID, during COVID and since. I do crisis center intervention. I assist in moments of acute crisis. One of the things is I get called immediately if there's somebody who's having a heart attack or if there's a full arrest, their hearts have stopped, breathing has stopped. I automatically get a call for that. Offering comfort and guidance to their families and to the patient afterwards if I see them, okay? Or during psychiatric episodes of emotional breakdowns. That could be in the emergency room when people come in. We might have a sitter with them, watching them, and so on. Emotional support, I provide non-judgmental presence. There's no judgment on my side. People say, I can't believe I'm telling you this, and they're going through meltdown and shame sometimes. And I just sit and listen because I know I'm compassionate by nature and I just know that they're going through what they're going through and I just need to be there for them, okay? They'll talk about their fears of ever getting well or just so many different things, okay? Ethical and cultural diversity. I respect diverse religious beliefs. I live in a diverse area, so we have, any given day I could have a Hindu patient, a Muslim patient, a Buddhist, that wouldn't be unusual, or secular, or people who have lost their faith. They might want to be interested in getting it back. They need something to rely on besides just themselves, and they might be seeking through my questioning, is there something that they should be in touch with that could help them, okay? Spiritual counseling, I explore a patient's relationship to God or a higher power and spiritual practices and sorts of spiritual support. Do they have a faith community? Maybe they've dropped out of their faith community, there was a problem. I might explore based on what I understand their beliefs to be, try to find a group in the area or where they live that they could attend services and see if that's something that, make contacts and find support from others. And also develop self-care and plans. I put together abstinence plans for people going through detox or our chemical dependency unit at the hospital. I carry a big attaché with so many materials that I can use based on religious or non-religious background that I can provide support for them. And I put them in an envelope called spiritual care resources, and I put notes and sign it. I'll put meditation sites that we went to, just all kinds of stuff. I might spend an hour and a half with a patient. That's not unusual, okay? Also, end-of-life care and grief support. I get called to a lot of these, or they're thinking about withdrawing treatment or so on. So I assess patients dealing during this time. Sometimes they actually don't want to live. They're struggling with that. I help them with those things. Grief and loss. I've done grief groups for many years, and there's a 3-part grief session that's also going, a 3-part series on grief that I've also recorded and will be appearing soon, if it's not already, on the recoverychannel.tv. Okay? Offering spiritual perspective on suffering and hope. Why am I going through this? Why is there suffering? Why does God allow this? Those are all those topics that are pretty common and that I explore with them. Okay. So thank you for joining me today. So that's a little bit about my background, what I do, like I said, on my day job. It's a very meaningful, very fulfilling job. It's a new career after I retired 14 years ago. This is an area I got into, and I enjoy it very much, obviously. If you are ever in need of a chaplain in a hospital, please ask for one. They can really bring some comfort and hope. And we are trained nationally not to evangelize or get you to accept what we believe, but to really explore what you think and offer resources in that area. Okay? Thank you for joining us today.